just going to chat you through various bits that we have in a kit bag that we give to you after your brace has been fitted. Initially we're going to start off with cleaning, and there's 4 headings under this: large brush, interproximal brushes, disclosing tablets and fluoride mouthwash use. The first of those, large toothbrush, normal standard toothbrush and toothpaste. And when you're cleaning your teeth, I'd advise that you do this properly, thoroughly, at least twice a day. When you're brushing half on the gum, half on the tooth, and you're just brushing that junction, 2 teeth at a time, working backwards and forwards, gradually coming round from one corner of your mouth to the other corner, and then onto the opposite arch of teeth, working your way round, half on the gum, half on the tooth. Once you've managed with your large toothbrush, we're going to change that to an interproximal toothbrush, or TP brushes, and you're going to use these between the metal brackets, underneath the wire, and on the lower teeth it's up away from your gum, working between the brackets, dislodging food towards the tip of your tooth and working all the way round. And ideally you're going to do this a minimum once a day. On the top ones, again working away from your gum towards the edge of your teeth. And once you've worked all your way around, the third item that you're going to use from your kit bag are the disclosing tablets. I'd ask that you use these every night for the first week so that we can hone your brushing technique in, so that you're making sure that you're not leaving any plaque behind and running the risk of marks and holes on your teeth. So follow the instructions with these, but essentially use a disclosing tablet, pop it in your mouth, swish it round, and the colour that, and then spit it out, and the colour that latches onto your teeth indicates you've missed that area, and you go back and brush it, and gradually you're improving your brushing technique bit by bit. Once you've got the technique with these disclosing tablets, you can drop that down to once a week through the whole duration of the course of treatment. Final cleaning part of the regime is a fluoride mouthwash. Doesn't matter which manufacturer you use, so long as it's a high concentration fluoride. Here in York Orthodontics we like the Colgate manufacturer. And you're going to use this once a day for the whole duration of the treatment. Second area that we're going to look at is with an appliance on your teeth, you need to think before you put anything into your mouth. The classic is you sat chewing on the end of a pen, and that's a very good way of breaking your brace. Don't panic if you do break your brace. Just be aware that 1, we can repair it, but 2, it is going to slow your treatment down. Give reception a ring and we'll allocate you to the next most appropriate appointment. If you can give us some indicator as to what's happened, then we can get the appropriate time and appointment for you. We have within the kit bag a material called silicone, and this comes in these little strips. From the strip you're going to break a little bit of the silicone off, and the amount is sort of a small pea size. Roll it between your fingers so it heats up a little bit. So for instance, if the hook on a bracket was digging in at the back, then roll the material and pop it onto wherever it's causing you problems, and that will stop the brace irritating. In terms of another adjunct for cleaning, within the kit bag we've got a travel toothbrush and a little travel toothpaste tube of toothpaste, and so again, if you're out and about, you can have that in your pocket or in your handbag, and that makes it a lot easier to use. Thinking about electric toothbrushes, by all means, they're absolutely fabulous. There is no one particular head on an electric toothbrush that will do the job. So your standard head, you can get the orthodontic heads by all means, but there is also an interproximal electric toothbrush head as well. And the ones that we have here on display are the Oral-B. The second area that we're going to look at is eating and drinking. So the groups of foods that you need to really be aware of is the firm crunchy type of foods, apples, carrots, nuts, those sort of foods. And within the kit bag we've got some advice as to what to do to avoid those potential problems. The other types of foods are the sticky type of foods, toffees and chewing gum. Please, no chewing gum whilst the brace is on. It can pull little bits off the brace, but it's also mechanically going to slow the brace down with its stickiness. So fast, efficient treatment involves minimising breakages and trying to allow the brace to function in its fastest mode without any stickiness. You need to think what you're drinking in terms of fizzy drinks or acidic drinks. Whilst it may not be possible to completely cut these out of our diet, try and limit them to just meal times only. Another little area that we need to think about is for those that are involved in sports. We do have, separate from the kit bag, a gum shield. We can have them custom made, but in actual fact we find that the ones that are demonstrated here, PowerGuard, you essentially boil them up with some boiling water, pop them in your mouth, and you adapt them, and as teeth move then you can readapt these, and these are perfectly satisfactory for protection. We hope this information has helped. You can refer to our website if need be, or get back in touch if you need any further assistance.